Here we have the pre-contrast T1 sagittal images, and you can see that there is a large cellular mass with supracellular extension. It has kind of a bilobed appearance, and it's also causing some uplifting of the hypothalamic area and of the third ventricle. And it's difficult to say. This may be a little bit of the usual posterior pituitary bright spot back here. We can see that the mass shows fairly homogeneous enhancement. And here on the axial and coronal T2 weighted images, you can really appreciate the degree of the mass effect that this mass is exerting. Here's the optic chiasm. And you can see that the optic chiasm is being uplifted, stretched, and draped. It's the morphology of the mass is such that it's having some more mass effect upon the right side. And there's also some increased T2 signal within the hypothalamus on the right side. Where is this? Right here. And then also this mass is causing some deformity and stretching of the right A1 segment of the anterior cerebral artery, simply because it's so large. And here are two post-contrast T1 coronal images demonstrating that there is some invasion into the right cavernous sinus. It's a little bit difficult to say for sure on the left. You know, it's not nearly as impressive, but certainly on the right side you could say that there is a cavernous sinus invasion. And then again, you can see the optic chiasm being deviated. This is a axial post-contrast T1 image, and this is just to show you that the mass is also kind of insinuating along the expected course of the optic nerve going into the orbital apex, more so on the right than on the left.